Kelsey, it's very nice to meet you. On Monday, Nest announced Nest Origin, which is a prenatal, postpartum, and infant care program for the Medicaid families that they work with. I'm curious if you could start with an introduction and let us know a little bit about yourself and your role at Nest.
Great. Thanks for having me. Super excited to be talking about this. I'm Kelsey. I'm our Chief Clinical Officer. So my role really involves helping to design and think about our clinical care and how we can safely provide care to families, both in the home and virtually. And we are prioritized on serving families on Medicaid and finding a way to make this work. And I'm a pediatric nurse by background. And so when I have spent a lot of my career thinking about child and infant health and really seeing and understanding the impact that a caregiver's role has on the child and infant health, Nest has felt just like such a natural way for us to operate. And so being able to bring in this prenatal program and line of care into the work we're doing now is really exciting.
I want to get to the details of the program and the announcement, but I was wondering if you could set the table for us a little bit. So, roughly 4 in 10 births in the US are financed by Medicaid. That number goes up a lot, actually, if you look at rural areas. And I'm curious to hear, insofar as there is a typical experience for mothers to be on Medicaid, what that looks like today.
Yeah. Great question. It's interesting. I mean, yes, Medicaid is funding a ton of births and a ton of deliveries. And the deliveries, I will say, like, those are happening in the hospital, right? Like, people are getting to hospitals and having babies. But what the care looks like during that pregnancy and leading up to pregnancy is where things start to fall apart and feel really complicated and overwhelming. So, for a woman who becomes pregnant, she has to find a provider who has capacity, right? So we hear so much about these maternity deserts. So one, just finding an OB in the area that she lives is hard. Two, finding someone who's willing to accept a patient on Medicaid is hard. And then there's all the social components that we know go into getting to a visit. So there's the transportation barrier, there's childcare, there's work, and maternity care, as any parent or parent adjacent person knows, like, this is a lot of visits that you have to do in a pretty short amount of time. And it's really consuming and it's really hard for anyone. And so for families and women who are trying to battle very complicated, complex lives, it's hard and the outcomes are bad. I mean, I'm really grateful for the visibility and the conversation that we are having nationally around this, but we just haven't seen a lot getting done or a lot improving, frankly. And maternal mortality is really bad. We're starting this program in Louisiana, which is the second to worst outcomes in the country. So a ton of opportunity. And I think the statistic that just like haunts me at night is that 4 of 5 maternal deaths are preventable. Like, this does not have to be how it is. And so this work that we're doing at Nest, it gives me hope, it gives me optimism, but it does require a real shift in how we're doing this, how we're paying for things, how we're helping women get what they need.
Can you talk to me a little bit about the program and how it works
Yeah,
and what it entails?
yeah, great. So our program, the Nest Origin program, is a comprehensive prenatal model that is facilitated primarily through certified nurse midwives. And we do that in close conjunction with some strong OBGYN partners. And I will say, just to start, we've been really fortunate to have very strong relationships with the health systems in our community in Louisiana. And they've been huge partners and support in this because ultimately it's helping them find patients that they are either accountable for or needing to find and getting them access to care before they go to delivery. So we have really strong OB partners who work with our nurse midwives to help set the eligibility criteria, the escalation criteria. And then the midwives are the ones facilitating the care in the most part. So our visits are both in-home and virtual. So, and that piece I just can't underscore enough. I know there are so many amazing companies doing work and trying to make this better and doing that virtually, but this in-home, in-person piece is, I think, really where the opportunity lies and really where we see the buy-in from our families. So our nurse midwives go into the home. They're able to do lab draws, fetal heart tones. We have a butterfly ultrasound device, which is really cool and able to do some types of ultrasound, like dating and size ultrasounds. They do all of that there. We'll see the patients kind of intermittently virtually as needed. And then we partner with those health systems and OBGYNs to get the patient to facilities when they need that 20-week anatomy scan. And then at 36 weeks, we transfer them to that facility to finish their last few visits there, kind of establish that relationship, deliver the baby, and then come back into the nest model for us to do that postpartum visit in the home with the mom and the baby.
Is this something, so I'm curious how this fits into the Nest model. I talked to the Rebecca's a couple weeks
Yeah.
ago. How does it fit into the Nest model overall? Are these things you were doing sort of informally and on an as needed basis, or is this a new line of business for Nest?
Yeah, great question. So the Nest model, comprehensive primary care, right? We have integrated licensed clinical social workers. We were certainly seeing pregnant patients as a primary care provider. We were not providing any sort of formal obstetric care. And so this is a shift, right? We are able to actually see and bill for those prenatal visits and do that really specific care. And to us, it is a very natural extension of the model and the program. I think, you spoke to our CEO, Dr. Rebecca Gee. She's an OBGYN by training. So this is really a passion project, right? We were going to end up at this place eventually. And her talk track, which is so true and important, is that by the time a woman gets pregnant, frankly, there is not a lot you can do to have substantial impacts on the outcomes of what's going to happen there. And so getting a woman healthy before she gets pregnant is really where we believe we can see the change in impact. And so for us to be able to provide primary care to these women, help them get set up and have an intentional planned pregnancy and a really healthy, great, strong environment, then shepherd them through that pregnancy and keep them in postpartum, help with the baby, right? Like this cycle, which I'm about to go on my soapbox here, so you can
Please do.
pull me
Please
up.
do.
But this cycle of a healthy woman having a healthy pregnancy, having a healthy baby, that then allows that baby to become a healthy adolescent, to become a healthy adult, to become ultimately like a healthy patient on Medicare who is lower cost, right? Like this is my pitch and what I am hopeful that someday Medicare sees the need for the investment in pediatric health, maternal health, right? Like this is the generation that's coming up that we're going to have to pay for eventually. And so Nest is just creating this wheel ultimately of trying to find an on-ramp and then get them in and starting to shift the outcomes for that family.
It's a really great story. I noticed in the press release that some of this work is getting funded by the David and Lucille Packard Foundation. There's program evaluation from UPenn and a control group. So you're really doing a, a, a quantitative study on this. I'm curious what you're measuring in terms of that study and what success looks like.
Yeah. I think there's two things. So one, there's a really longitudinal story here that I want to tell someday, which is that wheel, right? Like what does it look like to see the outcomes from a primary care through pregnancy to that child and family health? That's going to take a long time. So in the near term, some of the outcomes that we're looking at are early access to prenatal care. So making sure that the mom is seen in the first trimester. That is easier said than done, as many people listening know. And so by us bringing the care, reducing those barriers, that helps us to achieve that, and then increase compliance or adherence or visit completion during that pregnancy period. So we're aiming for about 8 visits during the pregnancy, and would be a substantial improvement versus what is being seen in the state level. We believe, which this is really adjacent to our primary care model, but we anticipate having pretty significant impacts on ED utilization. So in our normal primary care model, we've seen 60% reduction in ED utilization. And again, it's that building the trusted relationship, teaching the patients and families how to use and access primary care. And so this is the same, right? They have access to 24/7 nursing line, which then can get connected to their nurse midwife as needed. And helping to just shift that behavior of trusting that there's someone who is available and listening and going to help them versus just showing up at the ED because it's there and someone's going to help you. And then finally, I think fewer NICU admissions, but really I think our opportunity lies in the NICU length of stay. So when we can talk to that NICU nurse care manager and say, you don't have to worry about the transportation issues, right? We're going to go to that mom's house. We're going to help her. We'll get the baby set up. We're going to make sure it's a safe environment. Like that gives that nurse care manager so much relief and comfort and confidence in sending that baby home sooner than probably what it would be like normally.
That's great.
Yeah.
We packed a lot into that. Is there anything else that you want to share about the program, or anything else about Nest?
Yeah, I think just in general, underscoring Nest has been such a bright spot for me personally in a very tumultuous Medicaid landscape, right? I believe that we can do this for our most vulnerable mothers and families. And if we can make this work both financially and operationally, right, it's only going to serve the greater good. And so I'm really grateful for the interest in it. And I'm really optimistic that this can be a shift in how we think about providing care to these moms and families. But yeah, just grateful for the opportunity to talk.
Great. Thanks so much, Kelsey.
Great. Thanks, Martin.